Hi guys, and welcome to 2-Minute Tips for Autism. Well, we are so lucky we have Dr. Rossignol again, so welcome.
Thank you.
Well, here's our question. How do we get doctors to see autism as a medical issue and begin testing and treating? And again, how do we break down that barrier?
Well, it's difficult. If you look at most physicians, they may have 20 or 30 kids with autism in their entire practice who might come into the clinic 2 or 3 times a year. So you're talking about maybe 50, 60, 70 visits per year. So you're talking about most physicians, most pediatricians might see 1, 2, 3, 4 kids with autism a week. So they're not exposed to a lot of kids with autism. And a lot of physicians feel like, hey, I don't really know a whole lot about it. I've got a lot of other kids I got to take care of, so I don't have time to sit down and read a bunch of articles and go through a bunch of research to figure out how to help these kids. So a lot of physicians haven't been trained on the underlying biochemistry associated with autism, things like inflammation, immune problems, seizures, mitochondrial problems, etc. So they're more apt to say, fine, go see somebody else, or I really can't help you there. So what we want to be able to do is take that information, there's so much information out there, compile it into a way that other physicians can understand. So for example, taking all the studies that looked at mitochondrial problems in autism and putting them together into one paper and say, okay, here, if you want to know about mitochondrial problems in autism, read this paper. It's got all the studies kind of outlined and you can go through it fairly quickly. So if we can put that type of thing together for doctors, it helps them a lot because they're very busy too, and it's hard to get them to do all the research that needs to be done. So synthesizing things into review articles, for example, are very helpful. And then being involved with something like MAPS, which is the Medical Academy of Pediatric Special Needs, where we train physicians on some of this underlying biochemistry that you find in autism that's abnormal, certain treatments that you can do that would help it, certain laboratory testing to identify it. So physicians can attend a conference like that, which is just a couple days, and learn a whole lot about things that might take them years to otherwise uncover.
It's all in one place.
Yeah. So I think the more that parents can kind of educate their doctors to some degree, not that you're trying to tell the doctor what to do, but say, hey, you know what? Yeah, here's an article on mitochondrial dysfunction and autism. What do you think about it? And give it to the doc, and inviting them to go to conferences like this and having them take an interest, because doctors want to learn about it. Yeah. They're just really busy and they
don't know about it.
They may not know about it, and I think they do want to learn about it. It's just we need to make it as easy for them as we can.
Thank you so much.
Yes, you're welcome.
And thank you guys. And again, that's 2-Minute Tips for Autism. Until next time, bye.